We're live. All right. Hello, everybody. My name is Brent Agin. This is Dr. A, or Q&A with Dr. A. And so we had a couple people call in and they were asking for me to do a little conversation or a little discussion on gut health. And I think it's obviously a very important thing, so I am going to go ahead and conquer this. Just adjust this a little bit. So, you know, in my mind, the gut is still the heart of the body. It's really that important. And when you understand the specifics of what goes on between in our gut and making some sense of what the gut is, I think you're going to have a clear understanding of just how important it is to not only pay attention to your gut, but make sure that your gut is healthy. So first off, what is the gut? Let's just talk about that. So I think the misconception is the gut is just one thing, but it's really a collection of organs and also our microbiome, which I'll talk about in a second. So the gut is, just to generalize, the gut, let's just say, is basically your whole digestive system. So we'll say from your mouth to your anus is the whole digestive system. But truthfully, the gut just really means your intestines. But for this conversation, let's just say the gut is the whole digestive system, because basically when your food travels from your mouth to your anus, there's a lot of things that can happen during that whole process, which all of those things can contribute to whether you're healthy or you're having symptoms of disease. So that's kind of the gut. The gut is basically about 30 feet of organs in our body that, and then when you add the villi and the microvilli, which are these little finger-like projections inside the intestines, just to increase the surface area of the intestines for more absorption ratio or surface area, then you can see that we really have a lot of gastrointestinal tissue. So we have about 30 feet from your mouth to your anus. The largest part's going to be your small intestine, and then within the digestive system or your gut, you have this thing what is called the microbiome. The microbiome just means all of the bacteria, the viruses, the fungi, bacteriophages, protozoas, all these different microorganisms that mostly remain in the cecum of the small or the large intestine or the small intestine. And these microbes have to stay in a unique balance because they are responsible for so many different conditions, but most importantly, absorbing nutrients. And so if you don't have the right balance of good bacteria to bad bacteria, or I should say good microbes to bad microbes, then you start having gut disease. And so, just to put into perspective of just how complex this system is we have more bacteria or microbes, I should say, more microbes. Our microbiome is more robust than the actual human cells. There's like 10 times more microbes in our body than actual human cells. And so you can just imagine it's trillions of little organisms running around in our body and on our skin, and obviously have very important roles in our overall health. And because I can tell you that if your gut is not healthy, there's a reason for that, and there are reasons to figure it out. And unfortunately, again, I hate to beat up women, but women, just because of the shifts in hormones and the cycling of hormones, and your reproductive system being in one that has the ability to produce offspring, you guys have another connection with an increased risk of having gut disease or gut symptoms. But let's just keep digging in a little bit about the importance of the gut. So there's about 1,000 species of microbes that harvest in our body. I already said it's about 30 feet. We have viruses, bacteria, protozoa, fungi. We also another thing that's very important is that when you think about why we focus on the gut, is just think about what its job is. So we put food in our mouth, then it has to go down to the stomach to digest. And in the stomach, we secrete stomach acids, and in about 2 hours of being in the stomach, you got to drop the pH to where it can kill most bacteria. And then after a couple hours, it pours over into the small intestine. Another couple hours in the small intestine. The small intestine has a lot of those finger-like projections called villi and microvilli. These basically have these endings that just as the food's being broken down, which it needs to be broken down in the right the right fashion, so that these microvilli and villi can actually absorb the nutrients, and then the nutrients at that point start getting absorbed into the lymph and the blood, and then taken to the target tissues for energy production, immune response, and everything else. And then after that, it goes into the small or large intestine, and that's where most of your water is absorbed. And then you start on the elimination process, which then goes to your anus and then rectum into your anus. So you can see it's a long process. From the small intestine to the end of the small intestine to the anus, you're talking anywhere from 24 to 48 hours of transit time. And this all depends on the health of your intestines, what your peristalsis, which is basically the muscular movements that propels food and waste through your digestive tract. It all depends on the health of that process. And so just imagine all the different things that we do through our habits and through the foods we eat that could disrupt this whole system. And now, even more important is that just our gut is 80% of our immune system. So just now you can start to make sense of the importance of the gastrointestinal tract or the gut. It also is one of the biggest producers of serotonin, and I think everybody's heard the word serotonin reuptake inhibitors for depression. So now you can see all of a sudden why serotonin becomes a big issue, because now you can see how mental health also ties into the gut. And back in the day when there's a lot of women that had irritable bowel syndrome, and irritable bowel syndrome is just a disorder of where you're going back from constipation and diarrhea and mucus production. And again, it was mostly dominated by women. And you can imagine that the medicines that they used for irritable bowel syndrome back in the day were serotonin related. They had something to do with serotonin to try to calm the gastrointestinal system. So you can imagine when you get anxiety or depression or stress that you could end up having disruption of your serotonin production, and then you could see how that could tie into depression and tie into anxiety, and then kind of set this cascade of disease, because once you're depressed and once you're anxious, then that starts to affect your lifestyle and your regimen, and you kind of find yourself in a vicious cycle. So now you can see we got 80% of our immune system, serotonin production. We have this huge surface area in this whole process of getting food in our bodies, breaking it down, absorbing it, excreting the waste, so the waste don't build up, because any disruption of that process can start to cause symptoms and then disease, obviously inflammation. And so now you kind of understand the importance of the gut. But now what can disrupt the gut to make us start to not feel well? Well, I can tell you one thing. I mean, I would say 40 to 50% of visits to primary care doctors are gut related. There's something with gas, bloating, diarrhea, constipation. But then when you start tying in the gut into other areas of medicine, such as autoimmune disease, mental health, you can start seeing that the gut really plays into all possible conditions that someone would go seek help for. You look at the rise of autoimmune disease. So if 80% of our immune system is in the gut, you can imagine that if your gut is not able to mount a good response and allows your body to start attacking itself, that means there is some, what's it called, dysbiosis. There's some imbalance of the good bacteria and the bad bacteria. And you might hear me say that kind of speaking about the body in basic terms is if your repair mechanism is better than your damage, than the damage you're getting in, your body can win. And it's kind of the same thing with the immune system and your microbiome. If your good bacteria outnumber the bad bacteria, and it's 80% of the immune system, then 80% of your immune system can win that battle. So it's kind of the same thing. If your microbiome is basically your immune system, I always say that if your repair mechanism is stronger than your damage, then you're going to at least stay from having severe disease or a lot of various symptoms. But of course, we're wanting to have a very robust immune response so that we don't have any disease or symptoms. So if you're looking to prevent disease or you're looking to improve on symptoms that you're already having, you got to pay attention to the gut. So what are the leading causes of what you would imagine that would affect our gastrointestinal system or disrupt that microbiome to where it starts causing symptoms? Well, of course, number one is going to be stress. Stress is a huge influencer on bowel disorders. And again, remember, if you disrupt any bit of that process of food absorption, or food digestion, absorption, and excretion, you can start having symptoms. So stress, what it does is it causes our body to release various hormones that will tell the body what to do. So if you're putting out tons of cortisol because you're always in the fight or flight response, that reaction has compensatory reactions in the body that the body's going to try to have to respond to that. And so anytime you start getting inflammation or you start getting erroneous release of hormones, the body's going to have to deal with that. And if you're using up resources to fight something the symptoms that you already have in place, you can see you're kind of caught in a double-edged sword, is that you're trying to correct something that you haven't gotten to the root cause. And so, stress just kind of is one of those things that by disrupting lifestyle, causing inflammation, causing the release of some of our stress hormones, has a reaction of how it affects insulin and how it affects other organs in our body, including our brain. And so, and that also brings me to a point of, some of the surrounding organs that also surround our digestive system, like the pancreas, the liver, the gallbladder, the salivary glands. So there's other things contributing that I'm going to talk about. I forgot to mention the liver and the pancreas, but anyway, so what are some other causes? So we talked about stress. Another big one is our diet, which we obviously know. Everything starts with putting food in our mouth. And, going back to that cliche, you are what you eat, that is exactly right. And so anybody that's out there that is suffering from symptoms that are related to the gastrointestinal system, and you're not looking at your diet, then you really have to sit back and think if you are being logical at all, because that is the low-hanging fruit when you have symptoms of bowel disease. So if your gut is not acting the way it should, number one is start with diet. Yes, you can look at your stress, and there are ways you can manage stress through yoga and getting good sleep and exercise, all the different lifestyle options, but overall you have to look at your diet. And along with diet is most of the population is on at least one medication. And so another cause of disruption of our gut, our biome, is pharmaceuticals. We prescribe more antacids than any other country in the world, which directly results in magnesium deficiency and B12 deficiency, and we prescribe more antibiotics than anyone in the world. And antibiotics over time kill good bacteria and disrupt that balance between good and bad microbes. And that also causes B12 deficiency. So by just being on pharmaceuticals, too many antibiotics, and antacids such as proton pump inhibitors like Protonix, being on omeprazole, which is a generic, or Pepcid, or all these drugs you're using because your body is telling you there's something wrong, and so you're masking it by taking a drug rather than fixing the problem. And I can tell you, I've been guilty. I've had to take antacids, and part of that was from not making the right lifestyle changes to not have to take that pharmaceutical. But in time, you figure that out and you make those changes. So it's never too late to try to make changes. But when your body is telling you something, you need to listen to it and try to make a correction that's not necessarily just related on pharmaceuticals. Another big one is alcohol. I'm always going to talk about alcohol because alcohol is another one that if you have autoimmune disease, if you have SIBO, which is small intestinal bacterial overgrowth, if you have acid reflux, Barrett's esophagus, gas, bloating, diarrhea, inflammatory bowel disease, any of those conditions, and you're consuming alcohol on a regular basis and haven't thought about the connection between alcohol, especially as you age, and how it ties into bowel disease and a disruption of your microbiome, then you are missing the point again. So I'm going to put alcohol right in with poor diet, because poor diet includes what you put in liquids as well, and so alcohol is going to get thrown into there. So that is your main opportunity. And if anybody that just when we talk about treatment, I'm going to go really hard into diet, because that is an opportunity for you guys to really quickly see how healthy you can get. So what is some other causes? We talked stress. We talked yeah, that's about it. That's good on the causes. But as you can imagine, there's another good tie-in is the skin. So, inside our gut, we have, about 30 feet of small or gastrointestinal system. But then the other big connector to our overall wellness and a direct connection to our gut is our skin. So our skin is the largest external surface area of our body. It's one of the biggest organs just due to its sheer surface area. And we have microbes on our skin as well that are always doing work. And there's this growing area of research that's all focused on the skin and the gut communication. And there is a direct one, because what they find is that anybody with skin disorders, psoriasis, eczema, any sort of atopical dermatitis, acne, a lot of times when people clean up their diet or they focus on their gut health and their guts start to act normal, a lot of these skin conditions at least improve, if not resolve. And so they know there's a connection just because of the sheer vast amount of microbes on the skin, and they're almost equal, the amount of microbes on the skin in the digestive system. And again, remember, it outnumbers our human cells tremendously. So we have a lot of communication going in. When you start looking at what causes skin disorders too, is an exact symptom that you should pay attention to and potentially have a gut related cause. So what are the other symptoms of having dysbiosis or gut microbiome disruption or imbalance? Everything. I mean, you can imagine gas, bloating, diarrhea, constipation. We already talked about skin disorders. We'll talk about disrupted sleep, mood, brain fog, chronic fatigue. All of these things have a tie into the gut. And so when you look at some of the conditions like fibromyalgia or chronic fatigue syndrome, these again are dominated by the female gender. Sometimes as close to 90% female to men, 9 to 1 ratios. And so you have to think that when you're having any of these conditions, autoimmune disease, fibromyalgia, chronic fatigue, or any of the symptoms I just mentioned, you have to sit there and look and say, how is my gut health? How regular are my bowels? Do I suffer from bloating and gas after I eat? Am I having irregular sleep? Am I having any symptoms of mental health symptoms? Skin eruptions? If that's the case, then start by looking at your gut. So kind of going through, basically there's so many symptoms that are tied to the gut. So that's why I say it's kind of the heart of the body. Now let's talk about treatments. And so first thing is to recognize, and I can't, a great example of ignoring symptoms is that I already said that about 40% of people that are going into their doctors have some complaint of gastrointestinal symptoms. And so with that, you have to sit and look, saying, if there is something wrong. It's very easy when it's orthopedic or it's cosmetic. Like if someone has a big old giant growth on their face, chances are they're going to want to get rid of it pretty quickly. Now, and that goes the same thing. If you have a broken bone, if you have a strained knee, and it's limiting your mobility, it's limiting your activities of daily living, you would go and be much more inclined to get that fixed very quickly. But for some reason, we will tolerate diarrhea, constipation, bloating. And I have these conversations all the day with people, and yes, it's complicated, and yes, it takes some investigation, and yes, it takes some work. But the fact that we can ignore things that aren't going to slow us down, we can get by, we can take some antacids, we can take some Gas-X, we can use the restrooms. There are so many patients of mine that would tell me that they knew where all the clean bathrooms were in town, because they knew when they had to go, they had to go. So they knew there was a clean one at Publix. They knew, Sam's Club, that's what got the best bathroom in the world. Think about that. You're going out in your day and you have to think about where you can stop quickly to go to the bathroom, just in wanting a clean bathroom, which is understandable. But I think a better solution would be why are you needing to go to the restroom that much? Why do you have that impulsive feeling or urge to use the restroom, especially when it's a bowel movement? And so why wouldn't we take observing that we have these symptoms and not start thinking about, I need to start figuring this out and start getting into the science of things. And so the first thing to do is, again, is look at your diet. I mean, you should have regular bowels. And hopefully after we talk about some of the treatments, you'll understand why a lot of people have bowel irregularity is because of our society's health. And we are trained to follow what everyone does, which is to eat really, really bad and drink a lot of alcohol and not pay attention to the symptoms that are screaming at us, telling us that there's something wrong. So, you know what, then what you do is you can get caught up in some of the distractions. Now, I know plenty of people with actual bowel diseases, and you know, whether it's Crohn's disease, ulcerative colitis, or a celiac disease, there are diseases or conditions that definitely have to change your approach to how you would treat your bowels and how you also prevent them from being in a flare or keeping your body absorbing and your gastrointestinal system working. So a lot of these inflammatory bowel diseases can be actually treated by good diet, getting off of medications, drinking enough water, and taking some of the therapies that we talked about. And some of them you just have to, you know, obviously if you have some conditions, there are certain things you just can't have. That's fine. You have to work with that and you have to work around it. But overall, everybody can step back and take a look and start taking this on as a project to where they get their bowels working pretty darn good most of the time. And that is, again, that's going to be moderation. It's not saying you can't go out and have some bad foods. It doesn't say you can't go out and have some alcohol if you want. But I wouldn't do that until your body's functioning right. You know, so that, you know, it's kind of like the work reward. You know, if you got your body working right and you want to reward that by having a little, you know, going on vacation or having, you know, some of these foods that might not digest right or might be causing some of the inflammation and acidity and problems with our bacteria or our microbes, then you can do that. But why don't you wait until you actually have everything working before you start really pushing it? And so again, after you sit back and you kind of take a look at how is your gastrointestinal working, and that's even a oral, you know, I mean, when they see, you know, there's been a lot of research on just oral hygiene, and if people aren't flossing, you're not brushing your teeth, you're not taking care of your gums in your teeth, then that is a huge area of increasing chances of having pathogenic bacteria that then can go in. They've had connections to heart disease, and obviously connections to where you're using up resources again to have to fight these little infections and these little bacterial overgrowths that then cause you to use your resources in the wrong places. And so when you know, again, that the mouth has a direct association with inflammation and potentially various types of heart disease and potentially disease elsewhere, you know, start with cleaning up your mouth, doing your flossing, getting your teeth cleaned regularly, making sure you're brushing your teeth regularly. And that's going to go all the way down through your stomach and your stomach acids and when you know how you're when you're eating your last meal, not eating a big load of food before you go to bed, paying attention if you're having heartburn, paying attention if you're having bloating or gas. If you're having these, you need to start right away by putting a program together to where you can start seeing how you can get your bowels working right. And so when you look at the treatments, you really have diet number one, diet and alcohol, you know, foods, solids or liquids. You need to start going and getting very aggressive about doing an elimination diet. And if anyone has not done an elimination diet and you have symptoms of gastrointestinal imbalance, then start with that. And what an elimination diet is where you basically eliminate all foods other than one food type. Sometimes people will do chicken, some will do fish and vegetables, chicken and vegetables, but it is a very bland diet. No alcohol, no processed foods, only water. And you do that for anywhere from 7 days to 30 days. Obviously, a 30-day challenge is really going to give you a lot of information. You know, some people will also throw, you know, some carbohydrates in there in the form of white rice or, you know, some whole grains. But a lot of times it's just protein and vegetables. And you're going to learn a lot during that time because you're increasing your fiber intake and you're increasing your prebiotics, and you're getting rid of all the inflammatory foods, and you're going to get a good idea of what happens with your energy production, your mood, your sleep, your bowel symptoms. And at that point, you can say, okay, when I do this, you know, when I do X, this is the result I get. And if you know that, then now you at least have a baseline or a point to where you can say, when I eliminate all these foods, my gut feels better, I'm not getting bloated, I feel better. And then it's your job to slowly introduce foods into your diet to where you find, oh, that's one that's bad. Or, and you can start making a list of good foods, your good menu, and foods that cause your stomach or digestive system to be irritated. Another thing you can do is food sensitivity tests or food allergy tests. Not 100% perfect science, but yet sometimes it will give people the opportunity to see certain foods that do create some sort of a histamine response or an immune response. And those could be the first foods that you eliminate, and obviously the last foods that you would bring back. In a lot of cases, when people have food sensitivities, they don't tell you this, but when you have a food sensitivity, it doesn't mean that you're not allergic to the food. It means when you get your microbiome back under control, that if you over time, eliminating that food for a period of time and bringing it back into your diet could actually bring that food back in and no longer have a sensitivity to it. So like, people feel that when they told that they have a sensitivity to a specific food, they can never have it again. That is misinformation, because you can potentially bring that food back, but you got to do the right things, especially if it's a food that's nutrient dense and that you like. So you start with food, you start doing an elimination diet, you start seeing how your body works, and then you go from there, because again, it's worth it. This is the key to all different areas of health and wellness, and you're going to find the benefits of it real quick. Even just stopping alcohol for 30 days has shown people so much improvement in specifically their gut. Like, remember I said, it thins out the mucosa in your intestine. It blunts the villi that absorbs nutrients. It causes that syndrome of inappropriate bacterial overgrowth. So, and it causes a heartburn, and it actually can directly be toxic to our good, healthy microbiome. So just eliminating alcohol for 30 days usually causes people in that 30 days to not only see their skin improve, not only see their sleep improve, their mood improve, their symptoms of digestion improve, and everyone feels great, but for some reason, they still end up going back to drinking alcohol. So you guys can kind of look at that and think about how you want to approach it. Now, some of the other improvements or treatments that you can do, we talked about prebiotics, and prebiotics, all that is, well, let me go with probiotics first. So probiotics are just healthy bacteria and fungi that you can get. And a lot of times they're live bacteria and fungi that we put into our bodies to help balance out our microbiome, because in most cases, from antibiotics, medications, from stress, from bad foods, we start to have this dysbiosis, as I said, an imbalance of the good and bad bacteria or microbes. So you're just adding those back in, and in a lot of cases, it can help with skin disease, it can help with inflammatory bowel, and it can make people's digestion better. And then prebiotics is just things like fiber and phytonutrients, what are called polyphenols, that the probiotics actually feed on. And we're supposed to get between around 25 grams of fiber in every day. We don't even get close to that, not even close to that. And so when you start looking at your diet and breaking down what you're eating, and you eliminate processed food, you do an elimination diet, you get on some probiotics and prebiotics, you start calculating your fiber, calculating your water intake, you're going to start seeing benefits and results. And then it's up to you to decide how long you're going to continue that on if you're feeling better. But what I would say is that after you're adding the prebiotics, after you're adding the probiotics, and after you're taking care of your gut, you're eating better, and you're getting benefits, is that you make a menu of all the good foods that you're eating, different dishes that you can make, and making your food interesting so that you can create a menu of all good, healthy foods that you can intake that doesn't cause issues, while you're also making a menu after you start adding foods back in of foods that you that you can't eat. And you know what? You should be eating to live, not living to eat. So if there are foods that you have to remove from your diet and you have to eat robotic, but when you do, it equates to feeling amazing and having no symptoms, then you are directly working on age management, and you're directly preventing disease in the future. And that is worth it. Trust me, when you just have to start understanding that we're in a situation where you have to really take a look at your overall health and analyze where you're having issues and then start very aggressively how to correct them. So beyond prebiotics and probiotics, there's some other things that we can do, for our gut. This is crazy, but the science is getting to this point. So if you have very bad bowel disease or autoimmune disease, just to show you this connection of the microbiome and how it can heal, because it's 80% of our immune system, they are doing fecal implants. And so just imagine, they're basically taking stool out of one person and putting it back up into the colon and small intestine, if it reaches the small intestine, but they're basically putting that stool back in from a healthy person that doesn't have autoimmune disease, because they did studies to show that if they put feces from in rats from someone that had autoimmune disease into another rat, that those rats could potentially develop those conditions. And so now they're doing fecal implants, and they're doing this today on humans by putting in feces from a human donor that does not have disease, and the microbiome takes over and starts to cause these people to heal. Now that's powerful. It's gross, I have to say, but it's gross sounding. But you know what? If it's helping people, then by all means, I think it's a great therapy. But I'm thinking that you could probably stop, correct, before you have to get to a fecal transplant. Some of the other therapies that I really like, again, is we're in this race from changing our diets, improving our diets, controlling our habits, and then obviously using other therapies that would support what we're talking about. And some of those things on telewellness that we love, some of the ones that I always promote, that I use myself, one of them is BPC 157. BPC 157 is a organic compound that is secreted from the gastric juices of our stomach. So it's actually created within our digestive system, or within the gut, even though it's not in the intestines. But it's actually created in the gastric juices. And what it does is it helps with connective tissue, so soft tissue. It reduces inflammation, and it also helps with organizing or reducing acidity. So that is one. And the one other thing I like about BPC 157 is it's called body protection compound. And one of the organs that it works really well at protecting is the liver. And so the liver works directly with the gut and with the stomach on the digestive side. It's the one secreting bile. Bile is what is secreted in a result of breaking down fat. But it also helps to neutralize acidity. So when we have, our diets are very acidic. So bile is released from the liver into the intestines to neutralize acid, but also, break down fats. And then you have your gallbladder, which hangs behind the liver, and that is basically a storage form of bile. It's converted in the liver and then stored in the bile for release for when you eat fatty foods. And then you have your pancreas. Obviously one thing the pancreas does is secrete insulin for managing our carbohydrates, but the pancreas also adds digestive enzymes, so we can also break down carbohydrates, fat, and protein. So those are the other organs, and I like that body protection compound actually has had studies show that how it does support the liver. So even if you're using it just as we age, and that we have a society that is heavy consumers of alcohol, and the alcohol is a huge load on the liver, I think everybody could use a little bit of protection or improvements in liver function. And then another one that's new that we are launching, and I'm excited about it because I love peptides, and I think peptides is for sure a good opportunity for people that are trying to get into a healthy lifestyle, is KPV. And KPV is a derivative of a skin hormone called alpha melanocyte stimulating hormone. And what it does is it has very similar to BPC, but not the same, because it's another natural occurring compound. But what they have found, that it actually reduces inflammation and actually can have antimicrobial effects against a couple bacteria that are known for causing various wounds and skin lesions. And so it's a very good therapy for anyone that has wounds, who has inflammation in the bowels. So if you have inflammation, KPV is a great peptide for you. It doesn't do anything for healthy tissue. It doesn't have the protecting compound protecting that BPC will have. But if you have wounds, if you have inflammation, especially if you have inflammatory bowel disease or any sort of bowel disorder, KPV could be a great one for you to try, but definitely good for wound therapy. Another one is we talked about diet. So the carb rev, I still tell you intermittent fasting is a great way. Again, if you're trying to go from elimination diet into another eating strategy that can help manage your food and get you away from the cravings for processed foods, the overeating of processed foods, your alcohol consumption, just basically really managing a good managing eating strategy. Intermittent fasting is a great option. We also just, again, remember we are chronically deficient in B12 and magnesium. So one of the products inside the Carb Rev kit is what's called Night Cutter or the Trim PM powder. That powder is great. Women love it because it causes bowel regularity, so it helps with sleep at night, but also keeps, by giving magnesium in the form of magnesium citrate, especially for women that are more on the constipated side, it just helps with bowel regularity. And so the two minerals that I think that are underutilized or under supplemented is magnesium and calcium. So especially women, you should be having calcium to magnesium in a 2-to-1 ratio, but you have to have calcium, and calcium is another one. Both calcium and magnesium are chronically deficient, and then obviously B12 has a huge role in our nervous system and blood cells. So those are a few therapies, but you can see the most important thing is identifying the problem. And with so many people going to see their doctors with bowel symptoms, and I know there are a lot of people listening, especially women, that have bowel symptoms on a daily basis, irregular bowels, diarrhea, then constipation. And again, I will tell all clients that when they come in, women do have to pay a little bit more attention to their lifestyle. And understanding that is because I'm bringing facts. It's not picking on women over men, but when you have a higher risk of certain diseases or certain conditions, then you obviously have to pay attention to why that gender inequality there is there, and then pay attention to it more than the guys do. It's unfortunate, but if you want to feel good, you want to look good, you want to be happy, then you can't ignore your gut. And so just take it on as it is a project. It's a project, but it's a project worth winning. And when you can get to the point where you have very predictable bowels, and your oral hygiene is intact, your bowels are regular, you're drinking enough water, your diet is good, you're going to find that your energy goes up, you have less disease. You're not, because remember, 80% of your immune system, you're going to get sick less, you're going to be happier, you're going to have more energy, and that is what's going to lead to happiness. And so this was a great discussion on the gut. So whoever that was that asked about doing a little talk about gut health, I appreciate that, because it is a very common discussion that I have, but it's also a very difficult one to have with people, because this is, unfortunately, we do have some good products that can help with the gut, but this is just good hard discipline. This is you wanting to be healthy, you wanting to be happy and improving your wellness. Then it starts with having a good, if your digestion is perfect, your bowels are regular, you are completely regular, then at least you've eliminated that variable, and now you can move on to the next thing to figure out why you might be having some symptoms or just not feeling as well as you can. But this will be worth all the time you put into it. So again, just start paying attention. Don't give up. Just keep working hard on it, because at some point you will start putting together where you start getting regularity and you just feel better. And then the important point at that time is don't change anything. Don't do the 30-day elimination diet. Don't stop alcohol for 30 days. Don't, get on these eating strategies and get on these products and start feeling really, really good, and then stop and go back to your old habits, or stop what you're doing. Get yourself to a point where, you can get to a point where you might stop the KPV or the BPC, but intermittent fasting and finding that menu of foods that make you feel good, that is the key. That is, if you want to be in the top percentile as far as how you feel, your diet is the number one thing that's going to get you there. So don't feel bad, when people are out picking out on crappy food and you're sitting there eating healthy foods, or you're meal prepping every day. If you want to live like the small percentage of people that have really intact wellness, then you got to do things different than the majority of the population that doesn't. And that's the most logical thing that anybody listening should understand is if you want to feel a certain way in this small percentage of people in your age group, then you're going to have to do things differently than the masses. And number one is control and discipline, and unfortunately that means you're going to have to start digging in very deep and quickly into your habits, and so that you can arrange these habits to actually support everything you're trying to do. And when you get to the other side, maintenance is easy. You get to the point where you feel really, really, really good. You're on no medicines. Your sleep's good. Your bowels are good. Your energy's good. You have good muscle to body fat ratios. When you get to that point, you should have a clear picture of how to maintain it. And the maintenance is so less expensive, and the value of time and just how you feel is priceless. So put the work in on your gut, and the end result will be a lot better shot at overall wellness. So we'll see you in a couple weeks. I don't know what the topic is then, but I'm sure it'll be a good one.